I refuse to believe that the only way forward is one that's focused on extracting resources, putting our species above all others. I think that we live as an interconnected web of life. Fundamentally, everything we get for our survival comes from nature, whether it's air, water, food. Personally, I don't think that we should be thinking of ourselves as somehow exceptional and different from all the others. I think that the laws of nature also apply to us as a species.
Welcome to System Catalyst, the show that cracks the code for making the world a better place. I'm your host, English Saul. Today, I am joined by Neil Vora, a physician and public health leader working at the intersection of human health and environmental conservation. Neil is the executive director of Preventing Pandemics at the Source, where he focuses on stopping outbreaks before they begin by addressing the root causes like deforestation and biodiversity loss. He is a former CDC epidemiologist who has responded to some of the world's most serious outbreaks, including Ebola, Zika, and COVID-19. And he has led large-scale public health efforts like New York City's contact tracing program. Neil, welcome to the show.
English, thank you for having me. Such an honor to be here.
I'm curious, Neil, we've interviewed so many people on this show who have been associated or touched kind of these pandemics and these outbreaks, but I don't know that we've interviewed someone who's been as is so close on I think especially the domestic side of some of these outbreaks in the U.S. And I am wondering, could you tell us a little bit what it's like to kind of be in that zone when these outbreaks occur? Specifically, I'm thinking about COVID-19. What was it like for you to wake up one morning and then all of a sudden COVID was in the U.S.? How did you have to respond? How urgent was it? How intense was it? Can you tell me just a little bit about that work?
It's an awful feeling. You feel something in the pit of your stomach sinking, because there are always reports of new infectious diseases, but some of them have a special flavor that makes you especially concerned. And so thinking about COVID-19, I remember in January of 2020, this is early January, we started getting those reports coming out of China of this novel respiratory virus. And it sounded like this was something different. It sounded like this was going to be massive. And so at the time I was working out of the New York City Health Department as a CDC assignee there. But we started doing a lot of preparations at the ports of entry, like JFK Airport, working with our partners. Another example is with Zika. I remember back in 2016, we started hearing these reports of an arbovirus, meaning a virus that could be spread by mosquitoes that were causing birth defects. And it was just shocking, but it sounded like something was different. So it was that same feeling. It's never good, but also the call to serve is so compelling, and you want to help people.
Yeah, I can imagine that it's almost like this. Maybe it doesn't feel like an overnight kind of intensity, but as the buildup is coming, feeling like, oh no, this is something different. This is something that could really be have a tremendous impact. And I think that you've mentioned at one point that your interest in pandemics started when you were young. Can you tell me a little bit about how that came about?
Yeah, ever since I was a kid, I knew that I wanted to do something in public health, thanks to my dad. He was born in India, and when he was a child, he had smallpox, which is one of the worst infectious diseases you can imagine. And when I was growing up, I would see the legacy that smallpox had on his life in the form of scars that he still has to this day, over 70 years later.
Wow.
So I very keenly understood from a young age the impact that infectious diseases could have. And he was the one who told me about the CDC. When he did his PhD in Georgia, he had once been on a plane ride by a CDC Epidemic Intelligence Service officer. If you've ever seen the movie Contagion, Kate Winslet in that movie is an EIS officer. And so that was how he learned about this EIS program. He told me about it, and that planted the seed in my mind that maybe I could join this amazing group of outbreak investigators. And then I watched the movie Outbreak when I was 14 or 15 with my dad. And I knew that one day I had to wear a hazmat suit and chase dangerous diseases. And it's been a privilege to get to do that. I did join the CDC EIS program and fought outbreaks around the world.
One of the reasons I was just so excited to be in conversation with you is that, when we've talked before, you have this really wonderfully articulate way of talking about the intersection of the health of people and the health of the planet. And, selfishly, the foundation that I'm lucky enough to sit on the board of, my family's foundation, our motivation and our tagline is healthy people, healthy planet, and how we can serve at the intersection of that. So diving into this a little bit deeper, I think, a lot in sort of my experience in this space, a lot of people refer to what we're talking about as One Health. And can you tell me a little bit about how you might describe this concept of One Health to our listeners?
So that term was probably first used in 2003 by Billy Karrish, someone who has done so much great work in this field. And it's the idea that human health is inextricably linked to the health of other animals and the planet. And I'm so glad, when I was in medical school 2004 through 2009, this was not a term that I had even heard of. And in recent years, so it's been building steam, and we're seeing it actually being used at the highest levels of government. Actually, even President Emmanuel Macron in France has been talking about leading initiatives around One Health, right? It's great that we have heads of state now talking about this. It's also a concept that many indigenous and traditional cultures have understood for eons, that our health as people and communities is linked to the health of our surroundings, of nature and other animals. So I'm thrilled that there's a growing body of evidence around this. There's a lot more work to be done. But part of the reason why this term is increasing in popularity is that we are, as individuals, as private citizens, we are seeing the effects of our activities now play out even in our daily lives. I'll give you a story to put a finer point on this. My favorite thing to do outside of work and spending time with my partner is to train in Brazilian Jiu-Jitsu. And so,
amazing.
So this is, I think, is 2024 or 2023, maybe 2023, June of 2023. I'm training at my gym in New York City, and I go in there at 5 p.m. one day, and I leave an hour and a half later. And it was like the apocalypse had happened over the last hour and a half. The sky had turned red. I couldn't see to the end of the block. And this was all wildfire smoke that had drifted over from Canada. And this is in one of the richest cities in the world, where we were now feeling the impact of climate change. And it was a reminder that it doesn't matter who we are, how rich we are, where we live, we are all impacted by our actions as a species. And of course, some people are more responsible than others. We have to acknowledge that.
Absolutely. And, I think that it's funny because you answered another question that I was going to ask you, is how linked is this growing body of research and attention to One Health with the rise of pandemics and the rise of, these things that seemingly feel so out of our control when they happen, right? But are in fact very much within our control to prevent. So when you think about sort of the approach to pandemics and it being kind of reactive, right? How would you describe that? I think that in your TED Talk, you sort of say that our approach is fundamentally flawed. So tell me more about what you mean by that.
We all have heard that quote, an ounce of prevention is worth a pound of cure. And we know that it's better to prevent than to respond to things. Yet, unfortunately, our approach to new infectious diseases, most of which come from viruses that are circulating in animals, our approach to these types of novel pathogens is very reactive. We wait for them to jump into people, and then we try to respond quickly. But that's a fundamentally flawed model, because then inevitably, some people will get hurt. Even if we are faster with responding, some people will get hurt. And I don't want to accept that, right? To me, that means that some people are going to get sick. Some people might even die. On top of that, if you just look at the last 15 years, whether we're talking about Ebola or Zika, COVID-19, Mpox, right? Time and time again, these viruses, as they spread at very high levels, start to uncover their very surprising features that you don't see when there's a small number of cases. And I would rather, if I can, avoid having to learn about this at all, right? By not experiencing it. And so this is what I mean, that it's better if we can prevent than cure. And the good news is that we know that there are ways to prevent that emergence in the first place. By understanding why these viruses are increasingly jumping from animals into people, we can then devise preventative strategies, interventions to prevent those spillovers. And that's what the coalition I lead is focused on. That's what the scientific commission that I'm co-chairing is focused on. There's so many opportunities. We already know how to do this work. It's just a matter of political will for implementing them.
Can you just tell me a little bit more about what does one of those preventative strategies look like? Mm-hmm. And especially with the work that you're doing with the coalition, do you go and you sort of say, hey, we've got a preventative strategy, government X, Y, and Z. Can you help us implement this on the ground? How does that collaboration work, and what do those strategies look like?
It takes a lot of different forms. And one of the things I love about this Preventing Pandemics at the Source Coalition is that it has a number of different member organizations that work around the world. And so we are composed of leading international nonprofits that are working in the environmental space, in the health space, in all types of different areas that each come with their unique perspective. And on top of that, we have networks that we also tap into, right? So as we are devising, let's say we're devising a set of recommendations for how to do a better job of preventing these spillovers, before we publish any set of recommendations, we're also pressure testing those recommendations. So we just went through a round of pressure testing some recommendations in 4 different continents.
Wow.
In South America, in Asia, in Australia, and in Africa, right? So we brought together community leaders, thanks to the support of this philanthropy called Pax Sapiens, but we brought together community leaders and nonprofit leaders, local elected officials and others, policymakers, to give us feedback so that we can improve. So this always has to be a collaborative process. The underpinning of all of it has to be science, right? So we have to understand why these spillovers are occurring. It's because of things like deforestation, how we raise farmed animals, wildlife trade, and in the backdrop of all of this climate change. But with that understanding, we can then start to design interventions.
Got it. That's fascinating. And so when you're kind of okay, you're pressure testing these types of interventions, are you getting results back from those pressure tests? Are you sort of in real time seeing how they operate on the ground? And what does that entail for you, and how you're looking at the data, and how do you know what needs to be changed? How do you interact with partners if the pressure test maybe doesn't come back the way you thought?
So a lot of my work is at a meta level, right? So I'm focused a lot on global policy advocacy, or on giving high-level recommendations. I'm actually not doing the programmatic work anymore myself. That was my older incarnation when I was with CDC and the New York City Health Department. But our partners are doing exactly what you say, right? And I don't want to speak for them, but I know that they are always working alongside local colleagues, learning together, iterating, and improving. I'll give you a good example of this. So back in 2024, I got invited as a group of, as part of a group, to think about how to advance the cause of conservation and health in the continent of Africa. And so we, maybe around 40 of us, convened in northern Kenya in this group, right? People from outside the continent of Africa, people, many African investigators and experts as well. So we all got together. So the first evening there, we were sitting down right before dinner. It was a gorgeous landscape. We were overlooking this hill, waiting, the sun is setting, waiting for dinner. And all of a sudden I hear a thud and look at the ground, and there's a bat, literally, that fell out of the air from thin air. Now, I love bats. They're my second favorite group of animals after snakes. Right? So I get excited. Here's this bat. Now, our guide was this indigenous person. He was taking us around all of our different sites and coordinating all the needs. And he, as soon as he saw the bat, he sprung to action and picked up the bat and moved it to the side. Now, me, as someone who's worked on bat-borne diseases like Ebola, I got worried, well, maybe this bat was sick, and if so, then could this person who picked up the bat get sick himself, right? So I pulled him aside. I said, you should probably wash your hands just in case, right? 24 hours later, the next night, we're all, again, sitting around waiting for dinner, right? The sun is setting beautiful, enjoying the evening. And my colleague looks down at her foot. She's wearing sandals, and there is a tick feeding on her foot. That same guy springs to action and literally rips that tick off with his bare hands and is about to crush it in his fingers. And we're like, wait, stop. That tick might have pathogens like Crimean Congo hemorrhagic fever or African tick bite fever or something like that. So don't crush it with your fingers, put it down and crush it with a stone. So he complies, and then he turns and looks at us and chuckles and says that I have been ripping ticks off of cattle with my teeth since I was a kid. I have been catching bats since I was a kid, and I've never gotten sick. And it was a moment that reminded me to be humble. Here I was, a New Yorker, telling this man what to do, right? If he put me out on that land and outside of the gates of the hotel, within 15 minutes at that time of night, like a lion would get me, a hyena, something like that, right? And here I was telling him how to live his life, right? So it was just a reminder that I'm not an expert in the situations that these communities face. We have to work together as a team to come up with solutions.
That's such a great anecdote and way to share that. And for me personally, I probably would be really excited to travel with you, Neil, because I'd want to know, like, can I touch these animals without getting sick? And appreciating the reminder to wash my hands. But I think that's so true, right? There's so many practices, and that's where I think it must be really hard. You know, when we're talking about this, the way in which certain things are moved from animal to human, and when we're in the stress and facing down pandemics as people and looking for the source, and, you know, looking for the source, yes, for scientific reasons, but then when that desire to find the source gets political, I can imagine that's just a really hard space for scientists like yourself who lead with science and lead with data to be in, because we do have to be humble, and we have to respect that there's traditions and that there's ways of life that occur in a way that humans relate to animals, or humans integrate animals into their rituals, into their practices, in a way that maybe you and I don't, but we still have to be respectful for that. And I wonder how often at your work now you find yourself in those types of conversations of what it means to be science driven, and also be humble at different cultures and practices.
Yeah, I think you're bringing up such a good point. And it reminds me, animals are important for cultures around the world, right? And how one culture interacts with animals and their relationship to animals is very different than my own. I have a dog and 2 cats. I sleep with my dog every night. There are other cultures in the world, like my dog is literally sleeping on my pillow, right? Other cultures in the world would be like, that's not okay with us, right? And so who am I to mock other practices or they to mock me, right? We all have our different relationships, and I love animals. So the point is not to say like bats are bad, because they're not, or rodents are bad because they're not, right? We're all part of one interconnected web of life. And as this web unravels, there are surprising, often catastrophic ways that impact our own health that we need to be aware of. And so, you know, like you're saying, humility is so important here. It reminds me of one of my favorite authors, Robin Wall Kimmerer, had said in an interview, I think in the New York Times back in 2023. And she made the point, like, there are different ways of knowing the world, right? So one of the ways of knowing is through conventional science that uses the scientific method. And that is a great way of observing the world. And it divorces observation from values, which has a lot of advantages, right? Trying to minimize the bias so that we can get very precise measurements, as opposed to other ways of knowing, such as some indigenous ways of knowing that combine observation with values, right? So there's a value system embedded in that. And she goes on to make the point that, so through science, we have decades of information that the climate is changing, but it's divorced from a value system. So we're not compelled necessarily to act and fight that climate change.
Ooh.
And so I think it's just something for us to keep in mind, right? And I'm not saying that one way is better than the other. Actually, I think we need multiple ways of knowing, combining them to find the best outcome, because there's going to be limitations from any particular way. And I don't think we should be extreme in any of our approaches, and rather a combined blended approach probably will offer the best outcomes for us.
I think that what you're getting at, and a lot of the ways you're explaining this, is it just our entire environment and our entire ecosystem is a flywheel, right? It is that. It is a system of which contains many moving parts that all, when working well, work together for the best outcome. What does it look like, from your perspective, given your background, Neil, what does it look like to have a healthy ecosystem, right? Like if we think about a value system, how might we describe a healthy ecosystem and put value on that, right?
Such an interesting question. And my understanding of what a healthy ecosystem is probably very different than what people would have said 50 years ago, right? Our environment is constantly changing. And the normal for me is a normal where there's a lot fewer forms of life than there was 50 years ago or the 50 years before that, which is tragic and breaks my heart in a lot of ways. But we know that it's possible to live in balance with nature. I refuse to believe that the only way forward is one that's focused on extracting resources, putting our species above all others. I think that we live as an interconnected web of life. Fundamentally, everything we get for our survival comes from nature, whether it's air, water, food. And we just can't, personally, I don't think that we should be thinking of ourselves as somehow exceptional and different from all the others. I think that the laws of nature also apply to us as a species. That doesn't mean that we can't get better and better lives for more people. We should always be striving for that. And I'm so glad that if you look at the last 200 years, there have been massive reductions in poverty and improvements in literacy and more access to energy and food, and women have more rights. Right? These are all things we should always be striving for, and also figuring out how to do that in a way that exacts less of a toll on the planet, right? And we've gone, I think, in a lot of ways in a very extreme trajectory, but I'm also seeing so many examples around the world of people rebalancing and finding a new normal, and that gives me a lot of hope.
I mean, I think that's absolutely right. And, I think that what we can also say is, like, in pockets and places where there are healthy byproducts of an ecosystem, that has a positive impact on human health and animal health. And, what does it mean to live in a place where you're not, worried about the quality of the air? What does it mean to live in a place where you can eat food where you're not worried about that food carrying certain diseases? And, on the converse, what does it mean to worry about those things and actually have experience with those things affecting human life? I do wonder, and thinking about this idea of fully recognizing the value of healthy ecosystems, the climate sector in general, right? Like, where do you think we sit from a philanthropic point of view of recognizing that value and the funding of that catching up with where we need it to be, and really where the science is?
Well, I have to give a lot of credit to you and your family foundation, because you all are some of the few that are thinking from a more systems context. Case in point is the fact that you have this podcast, and I'm so honored to be here and having this discussion with you. But we're not seeing that in a lot of other spaces, and it really makes me sad. And I understand why, right? A lot of funders are focused on short-term results, very focused on measurable outputs, right? They want good value for their money, which totally makes sense. So many people are dying right now, and so many bad things are happening, right? So there's a very important need to get results as fast as possible. And so that's why I think many of them operate by the mantra, what gets measured matters. But the converse is that not everything that can be measured matters, and not everything that matters can be measured. And so I worry that we're kind of losing some of the bigger picture if we just pursue short-term goals above all else. Because if you want systems change, which does require higher upfront costs, but then long-term cost savings. But if you want that systems change, that takes a lot of time to actually play out. And another thing is that many of the philanthropists are people who've built their fortunes based off of technology. And again, technology offers so much promise for bettering the lives of people and also for helping the planet. But if we only view outcomes with a technological lens, I think we also miss opportunities to advance other causes as well. So again, this is where I urge us to think about balance, bringing in a lot of different perspectives to the table. There's enough room to bring more chairs to the table and hear what other perspectives have to offer.
I think that that's really true, and I appreciate your candor and also your just noting what we've done at Saul Family. And I wonder too, Neil, how does what you're saying play out in your day-to-day work with bringing different perspectives to the table? And you mentioned working with different partners on the ground. And I think that you all work with different governments and different philanthropists and different investors. And what is it that you've learned about what it takes to bring all those different perspectives to the table?
I think it's not easy, right? Like when One Health by definition is about bringing different perspectives to the table. So I'm a medical doctor by training. I still see patients in a tuberculosis clinic. The way I think is about human lives. My language and the problems I care about is often very different than what my veterinary colleagues care about, or what my ecologist colleagues care about, or my anthropologist colleagues care about. We use different languages. We have different outcomes that we're looking towards. And so when we get together, there will be a little bit of tension necessarily, but that's actually a good thing, right? We often go in different directions, but as we spend more time together and we build trust over time, we start to converge and we can see where our missions align. And ultimately it comes down to the mission, right? If we all understand that our mission is the same, we can get past some of these differences towards that end goal. An example for this is with this Lancet Commission that, again, I have the huge honor of co-chairing with two fantastic other people, Raina Plowright, Latifa Hassan. We have assembled a team of 30 commissioners, half of whom are women, half of whom are from lower income countries, right? We were intentional about trying to get these different voices as part of our team. And it just leads to such a better quality discussion. Mm. So it can take a little bit longer sometimes if we're talking past each other. But the way we did this from the day one, thanks to one of the commissioners, Robin Alders, she said, from day one, we need to come up with a glossary. So that at least when I say the word intervention, like the way I mean intervention is the same way that you're talking about it, right? Like otherwise we can talk past each other and our good intentions can be overlooked.
What a great initial exercise when bringing people together and building trust. I can't tell you how many conversations I've been a part of where I will say the word impact and someone else will say the word impact, or I'll say the word development and someone else will say the word development. And we're actually speaking two different languages because we haven't aligned on exactly what we mean by impact or development or intervention, or, these words that can take so many forms and can be so context dependent. Mm-hmm. And what a great thought of starting out some of these meetings with when you're bringing so many different perspectives to the table of saying let's define for this group what intervention means. What a great tip. I think that I hope some of our listeners take that and use that. I know that I'm going to do that. And some of these meetings that I have where it sounds like people are just, coming from different languages, right? And so where have you witnessed or been part of where there's been a situation where a coalition or a group of people have come together, and even though it was probably very difficult and there were moments where it was really hard, where have you witnessed where you're like, that really worked? Like that coalition or that group of people and the way they came together and the outcomes that were achieved, like that worked. Can you give me an example of that in your career?
For me, the best example would be on May 6th, 2020, Mayor Bill de Blasio asked me to lead the city's COVID contact tracing program. I was based in New York City. We had just been hit by the first wave of COVID. We were hit harder than a lot of other places in the country. It was awful. And the task was to hire over 2,000 contact tracers and set up a brand new contact tracing operation in less than a month. He wanted us to launch this operation on June 1st. And I had the great privilege of leading this team. And as we moved about this operation, the first thing I did was to bring in some of the most trusted colleagues that I have from the New York City Health Department, people who are just the most selfless public servants that I know of. Kathleen Blaney, David Lee, so many others. And we went through so much in that 24-day period. Then we had to hire 2,000 people. And as we were hiring this initial cohort of people, we preferentially hired people who from areas of the city that had been disproportionately impacted by COVID. This is part of our equity efforts to almost do reparations for the inequitable impacts of this pandemic. What got us through all of this every day was the mission, right? We were there to serve and to save lives and to help New Yorkers through awful, awful times. Number two was the people. Again, like these were just such incredible people. And we worked, I've been through a medical residency. I've worked hard in medical school and all that. I've never worked as hard as I did at that moment, but it was because of the people and the mission, right? So I would always come back to the mission. And, with the work that you're doing for the Family Foundation, with the work that I get to do, we are so lucky that our work just feeds the soul in a way that nourishes. I consider what we get to do as near sacred, right? We get to save lives, protect our planet, take care of other animals. Is when it gets hard, I always remember the mission. And I'm just so grateful that I get to do this every day. I get paid to do this. Like, it makes me emotional, but it's amazing.
I wonder if you were to give any advice to people who are embarking on this journey, this work of systems change, what advice would you give them?
My first advice, I guess, would be not to give up. It's the world as it's currently designed, I think in a lot of places, is focused on people who can dive deep and narrow into topics, which is really important. We divide up the labor and we focus on our little part, right? And don't get me wrong, that is so important. But at the same time, we need people who can lift their eyes and see the bigger picture. And that's not seen as of high, as being that highly valued. And if you have this view, though, that we need to be taking a holistic approach, don't give up. It's not easy to do this type of work, but it's just so important, right? To bring these different threads together and understand that there are ways to protect nature and at the same time lead to better lives for people and prevent future pandemics and protect biodiversity simultaneously, right? We need to be thinking how to make each dollar spent go further and further, because we live in a world of scarcity and it's getting harder and harder to do this work. And so number one is don't give up. And number two is for no matter what stage you are in your journey, you might be familiar with this concept of ikigai,
Yes.
but asking yourself 3 questions continuously, right? On a regular basis, not necessarily continuously, right? But what am I good at? What brings me joy? And what does my community need from me? And ideally, you are at the intersection of the answers to those 3 questions for yourself. Or every step of the way in your life, you're getting closer and closer. And I'm so lucky that I get to be exactly there. And when you land there, then it just becomes harder and harder to ever leave it, right? So then you're not going to want to give up. You just have to find a way to keep doing the work.
That's such spectacular advice. I love that you brought up ikigai. I don't know if it's been brought up on this podcast before. So I love that you did that. And I remember being kind of like at these different phases of my life where I'm like switching, to a different role or a different, job or something like that. And literally like making the circles around and listing all the things and figuring out where that nexus is. So I appreciate so much that you brought that up. Neil, we do something on this podcast where at the end of the episode, I sort of ask our guest if there's a question or a quote or a quandary or something that you might want to leave our listeners with as they're on their, commute home or as they're listening to this podcast, is there something you want to leave our guests with, a question maybe for them to think about?
Maybe I'll leave them with two things, not questions, but things that are very important to me. Number one is you can't take care of others unless you're taking care of yourself. And it's very easy to keep giving, especially, many people might have busy family lives, whether it's children or animals to take care of or aging parents or whatever it is. But you can't take care of others unless you take care of yourself. And in my case, I'm so lucky I have an amazing partner and family and amazing work. But Brazilian Jiu-Jitsu, I don't know how I survived without that. Like I stumbled across it in 2018. But find whatever it is that gives you that state of flow outside of work. So that when you get back to your work, you're recharged and you're ready to keep doing it, because this work grinds on you. There's a lot of grief.
Yeah.
Number two is that science and facts are the basic currency of my life, right? I see the world as a scientist, but we also have to remember that for the radical transformation that many of us want to see in the world, where there's more opportunities for everyone, we need to also bring in art and philosophy and feel inspired. And so don't neglect that other side of yourself, right? We have to have a mix, a balance of both, so that we, again, feel energized and can see a better world.
Very well said and very important. Thank you.
Thank you so much for this opportunity and for the work that you're doing. And I'm just honored to be here.